So my name is Robin. I'm a certified athletic therapist here in Alberta. Um, I have been involved in sport and varying different sports for over 20 years. So I can bring a wide variety of knowledge to the table. Uh, just for a little premise about tonight's thing, I have gone mostly with the Alberta guidelines because based on where I'm in, with a little bit of BC. So if you are not in Alberta or BC, you can feel free to send me some messages and I'll look at your specific province. So Safe Return to Dance, a guide for teachers. So we do need to remember that through all this time we have these dancers who this is their passion and their joy and they feel like it's been taken away. So as they're coming back into the studio or being allowed to dance again, there's nervousness but excitement, and in some ways we need to be able to control that excitement. Little disclaimer. So the information I'll present tonight is to help you understand what should be done or different ways you can bring yourself back into the studio and teaching classes in person. Please make sure you follow any provincial or federal guidelines that have been put out. Depending upon where you're at, you may have kind of a governing body guideline, so always refer to them as well. This is just kind of to help get you through all that information. So with COVID-19 and physical activity, we want to stress that as much as it's not an airborne disease, it can be transmitted through the droplets in our breath. So if we cough, sneeze, breathe, the water, it's attached to the droplets and they transmit to other people. That is how we can get contamination on surfaces. If you're breathing and happen to touch the door or sneeze towards the door and someone touches it after you, that's become a contaminated surface and they could transfer it to themselves. It cannot go in through your skin. So how it is transmitted is by touching your eyes, nose, or mouth, or directly inhaling the droplets if you're in close proximity. So currently, depending upon where you are, mask wearing is being encouraged, but it is not encouraged for our physical activity, especially intense levels, due to the fact that as we're breathing heavier, the masks get wet, and then therefore they're ineffective. So this is why in most places we're still recommending physical distancing when doing physical activity. So if you're able to come back to training, we're still recommending, if you can, to train outside. That's because inside buildings, the rate of transmission can be increased. There's not the air to take our droplets away. We have to deal with the HVAC and the air intakes. So train outside if possible. We are recommending 2 meters, and this is following the guidelines, 2 meters apart for distancing, though there is a little bit of confusion based on which set of guidelines you read if you're coming out of Alberta. So the dance-specific guidelines say 2 meters, yet the sport guidelines that reference dance say 3 meters. I'm saying 2 or 3, erring on the side of caution, do 3, but you are allowed to do either or. Oops. Sorry. We want to try and modify our classes and training sessions as much as possible to allow for physical distancing. I apologize, my mouse is extremely sensitive tonight. So the Canadian Association of Sports and Exercise Medicine came out with a risk assessment form that you can use. And again, I apologize for the slowness. So when doing this, it's for sports, but we can definitely apply it into dance. So you're going to do a risk assessment before you even start. So you're going to look at where the training is going to occur. So do you still have active transmissions? Where is the facility going to be? So are you in a facility that's just your dance studio, or are you in a shared venue? Is anybody coming in for the training in regards to club participants? So is anybody of high risk? So those over 65 of age. When we talk about underlying health conditions, we're looking at diabetes, heart disease, obesity. Asthma is one, but it's actually down on the list in regards to participants who would have a likelier chance of getting severe symptoms for COVID. Then you're going to see, is your training considered a high risk? So the closer you have to be for your training, or would be the higher risk you are. So if any of these are yes, you put a 1. Are you going to be doing any training? So this would be if you're doing cross training, you would put a 1 and you get your total. You go down to the assessment score and you look to see where you're at. Most of us, unfortunately, are not going to be in a 0 to 1. We're probably sitting in those 2, 3s, and 4s. So with these, you have to then decide how you can modify your risk. So after going back, you would then do a second one after you modified. The mitigation checklist kind of breaks things down into what you can do to help lower the risk in your risk assessment. So that's just one tool you can use, especially if you're working at numerous studios, that you can do one for kind of each area you're in to see what you can change to make it more safe for you and your dancers. So the one big thing we've all been pushing and hearing is about hygiene. So you and the dancers, we need to wash our hands regularly for 20 seconds, making sure you're getting all surfaces. Thumbs are the biggest part missed, so make sure we're getting our thumbs. Have hand sanitizer stations provided. You can allow students to carry a hand sanitizer with them into the room. Remembering and reminding them that we want at least a 60% alcohol in the hand sanitizer. We want to talk about avoiding touching the face. I did a sport version of this last week and mentioned the touching the face, but didn't have to bring up the fact that if you're doing choreography further on into the year or working on combos right now, we need to avoid having any of the hands across our face motions. So when working on that, try to avoid any touching of the face. So any equipment or props. With conditioning, of course, we're going to want to start bringing in, use of yoga blocks and stretching ropes, have each participant bring their own, and to encourage them to clean them when they get home as well and before they bring it back into the studio. If you're going to use props, if you're able to have a prop per dancer that they are now responsible for, and again, encourage them to clean it as much as possible. If you're sharing equipment, you need to check to make sure that it is disinfected. I was doing some reading and finding out that some of the floors that the studios have do not react well to certain cleaners. So before you start figuring out how to sanitize your floors, check what you can use to do so. One of the recommendations was a 90% alcohol mixture in a sprayer and then washing the floor with a mop after. But again, checking to see what the floors can handle. If you're having any shared equipment, make sure it's cleaned regularly. So especially the bars, they need to be cleaned before and after class, making sure that you're if you can have this person be at the same spot each time so that you're not having to clean in between dancers. If you are working on any acro skills or involving your mats, it should be 1 mat per dancer, and they need to be disinfected after class as well. And making sure anything that we're disinfecting, we're allowing to dry before we put it away. If you have any questions at all through it, just put it in the chat. So what happens if we are in a public facility? What happens here is we need to actually mix the dance protocols in with the public facility protocols. So are they allowed to arrive whenever, or do you have a specific window of time that they can come into? Is there a specific group they have to take in if there's more than one entrance? Most of the time, if you have a public facility, you're probably having them clean it after your classes. Now that we need to clean between classes, who's in charge of that? Is it you, or will the facility maintenance take care of that? And understand that you do have less control of who your dancers will be around as they're coming into class. So creating groups. So if we're unable to distance, and as we start getting into the fall and starting our next year's dance season, we need to look at creating cohort groups. And I feel very, very sorry for you guys as dance teachers, because working on this and realizing the problems it will cause as you're doing that. So currently a cohort's allowed to be 50 people. Again, I'm doing Alberta regulations and guidelines, but that includes you as the teacher, any guest choreographers you have coming in, the dancers themselves, and staff. Due to everybody that needs to be involved, I would kind of recommend you have no more than 40 to 45 dancers in that group. That way, if you are having to, say, have a teacher sub come in, you're not at 49, or if you were the 50th person, you're not bumping over to 51. You need to keep in the same cohort group. Otherwise, you have to isolate for 14 days prior to switching cohorts. So, did a couple of little diagrams. So you have group A, group B. You can split them up into small groups of varying sizes within the amount you have, and that's perfectly acceptable. Now we know it doesn't work as clean and simple as that. So I have group A and group B. These could be our different ballet levels, depending upon how your studio splits them up. Then we form them together to form group A and B. That works fine as long as our numbers stay under 50. But what happens if we want to take part of that AB group and take 2 dancers out of our C group and bring them together? If that puts us over 50, we can't do it. So if A and B are each 25 dancers, or 24, and we bring them together, we're okay in AB, but as soon as we bring in Jane and Susie, we're going to start pushing our numbers, as well as who else we're affecting because of how big is size C, right? Does that make sense? Thumbs up in the chat. So, going on to screening. When dancers are coming in to either class, or if you're doing drop-in sessions right now, you will want them to complete a symptom screen. Recommended about 2 hours, no more than 2 hours prior to the class. That way, if they wake up fine and they feel great, but let's say class is at 2, how you feel at noon could be very different than how you feel at 9. So do a symptom screen. It can be paper or online. You just need to keep the documentation. You can do temperature, but it is important to know that temperature is a late symptom. So but it may be the only symptom they get. So don't use temperature as the be all end all, but it is a nice screening you can do. Right now it's not too bad, but when we start getting to the really hot days, or in the fall and the winter when we get to the cold days, we have to allow a time of about 10 minutes for the skin to acclimatize. Otherwise, what you're doing is you're getting their outside temperature, not their actual temperature. So on our 35 plus days, especially out in Ontario, they're going to read hot when they might not necessarily be that. And in November, we might get them reading under when they actually do have a fever. You can have your dancers wear masks as they're entering and exiting the studio and during the symptom screen. It's not a mandatory thing, but it is kind of a nice extra layer of protection that you can do. If you are doing the screening, it is recommended you wear a mask as well. So the dreaded what if someone does show up with symptoms? So if they show up and let's say they do a symptom screen on site, you need to have a rapid response plan as to what to do. They need to be isolated from everyone else, sent home immediately, so find a way to get them home safely. You need to clean everything that they have been in contact with, and hopefully they haven't been in contact with any of your other participants. There, unfortunately, has not been any strict guidelines and policy in regards to should you continue that day's session or not. You can err on the side of caution and postpone the session for the day, or you can continue with those participants that do not have symptoms. But it is good to point out that if they did come in contact with the dancer who does have symptoms, they should as well be sent home. So if someone tells you via their symptom screen, or they send you a message saying, I have symptoms or I have tested positive, what you need to do is go back to your attendance list for the last day you were together. You need to let those people know, and then advise them that they should isolate for the 14 days or until the symptomatic person gets a negative test. When taking the information down, it is only voluntary. They can say, no, I don't want to give you, if let's say you're doing drop-ins, they can say, no, I don't want to give you my name and contact information. Just let them know why you're doing it as well, that you're taking it so that if you are made aware of someone who has symptoms or tested positive, you can contact them. So studio management. So they come in, make sure they're cleaning their hands as much as possible. There should be hand sanitizer stations pretty much everywhere. Recommending exit and entrance of rooms, in the bathrooms, if you can have extra ones in each studio as well, just so they can clean their hands after, let's say, working on the bar. They are not allowed to share water bottles, and they should be washing their bottles between sessions. There's no eating at the studio, so that's not a big change for you guys, but it is a good reminder. And then going back to keep track of your attendance records for 2 weeks and make sure you're following your local FOID protocols. So when it comes to the grid system, and I've seen many studios pictures of their grids, and everybody is doing the best they can. So we have 2 meter by 2 meter grids, and so some places look where you have next to each other. So let's say we have a dancer who decides to dance on the edge of their box. Well, it's okay as long as the person next to them as well moves over to their box. Okay, so when working on combos or even working on technique, try and encourage the dancers to stay in similar spacing in their box. So dancer C, she's in the middle. Dancer D is in the middle. Yay. Then our next 2 dancers, this unfortunately is a no because we don't have that 2 meter separation between them. And our last set, again, is a no. So these 2 dancers are fine, but unfortunately with that dancer in the middle, it doesn't work. So same grid system. How else can we arrange our dancers? As long as they're staying in their same distancing, we're good. But again, we're always going to have that one that's going to throw it off. So putting them in adjacent boxes is something I'm not really recommending. And mainly it's just because you have one dancer whose step might be a baby step that moves 6 inches, and you'll have a dancer whose step moves them 1.5 feet. We also have, especially with the younger kids, they're just not going to quite understand the whole keeping the same spacing. So I am kind of not recommending this adjacent boxes at the moment. So another way we could do it with these ones is to stagger. But unfortunately, staggering doesn't always work. So I'm going to show two more systems of gridding. So having your 2-meter boxes with a meter in between. This also does help for you as a teacher because you can now walk in between the boxes to help in your teaching and be able to give guidance. If doing so, I do recommend that you have a mask on because you could be decreasing your 2-meter space. So edge of the box, middle of the box, because of the meter, we're good. They're actually going to be 3 meters apart here. This one works because top with the meter in between, they're still maintaining their 2 meters. But unfortunately, this one doesn't work because it's only the meter between. Again, so if we're now putting dancers in 4 boxes, everybody's moving around, so they have a little more freedom. But these 2 dancers wreck it. So this is ideal world that you have a 2 or 3 meter box with 2 or 3 meters between them. Because no matter what spacing they decide to do, you're maintaining your distance. But I'm very well aware that not every studio is going to have that freedom or flexibility. So now that we've entered summer, I know everyone's kind of in a different stage in their season. Some are kind of trying to make up for time that they weren't allowed in the studio, but right now we've got lots of camps, intensives, and drop-ins going on. This is great because dancers are getting back in the groove. You as a teacher kind of getting back into being in studio as well. Things you need to remember is that some of these dancers haven't really done anything for months. Even if they were doing classes at home, there's a very big difference between dancing in a studio versus dancing in your living room. Others will have maybe been doing something else. They might have started to run, they might be riding bikes, they're having free time to actually play in the backyard. So everyone's at a different place. Do your distancing, because this goes back to we're not cohorting in camps and intensives. As soon as you cohort, those people they have to move along together in a group and they can't go to another group. We should be focusing on technique and working on different skills and encouraging teachers to wear masks. This does allow you to be in a little bit more closer contact with the dancers if need be. There are no performances being recommended at this time for children. We need to consider once we do get to that point in time, hopefully in the spring, if we're allowed to go back to competitions and performances, we do need time to ramp up. We can't go from dancing in our box to dancing full out, needing to cross half a stage. So we need to work on our ramp up time, be as well as spectator requirements. So if you are having mini performances at your studio, make sure you're taking in consideration of how many parents that are allowed to be in there. And then dressing rooms. This is my nightmare when it comes to competitions right now, is the dressing rooms, which we know do not have space for social distancing, and definitely you need to be worried about your cohorts. Again, as it was brought up in one of the guidelines, is we should not be doing any flash mobs at this time. So, injuries typically occur from doing too much too soon, after doing too little for too long. So most of us stopped doing active in studio classes around March. in the middle of March. Varying studios did different things. Some studios got right on it, figured out how to get online in classes, and dancers were dancing in class by the beginning of April. Others decided not to do that or didn't have the facilities or ability to do so. And so dancers were kind of left to their own devices. So we don't really know what all our dancers have been doing, but we can guarantee they probably haven't been doing as much dance as they normally would. So when you're scheduling your class, so not doing your big overall schedule, but scheduling how you're going to run your classes and making your plan, you need to remember that you are the jockey and your dancers are your horses. And they're going to want to come out of that gate like a bat out of hell and run for that finish line. They don't know what the finish line is yet. They're just so excited to be in studio and dancing with their friends and their teacher that they're just going to go full out. So we need to ease them in and control that. If you're coming back into the studio, if you're used to doing hour and a half, 2-hour classes, maybe shorten them down to 45 minutes to an hour, just to help build the dancers' stamina back up and get their bodies used to dancing again. You can schedule sessions between a day between your sessions, especially if we are having to do those longer ones, and make sure you're scheduling enough time for you to clean and screen your next group coming in. So as we know, things are very different. I like to stress that we're looking for familiarity, not normalcy. So if you were a very hands-on teacher, you need to make sure you're following your provincial guidelines in regards to distancing. And as I said, I only recommend it if you were wearing a mask, and I'm taking that from kind of the health professional standpoint I'm in. So I can have my mask on and therefore I'm allowed to touch a patient. And so if you're needing to be able to be a hands-on teacher, I encourage mask wearing. Cloth masks unfortunately don't work in this setting. You do need to have what we would call a procedure mask, and limit your hands-on. You might need to adjust your style. So if you're a very hands-on teacher, you're going to need to learn how to describe things better. My son started karate during COVID, and his sensei, through not being able to, of course, touch the students and be with them and demonstrate as well as she normally could, found a total new way to explain a skill, and found that new way actually got the students learning it faster than even being in person. So you're going to really work on how to describe technique and exactly what positioning you want them to be. Having moved to doing online sessions as an athletic therapist, I can tell you it is very hard when you just want to reach out and touch the dancer and touch the patient and put your leg where you want it. So your descriptive words are going to come in handy. Right now, really, you should be focusing on technique more than choreo, especially because we don't know where we'll be in the spring. So it's kind of use your time well and get your dancers stronger and make them a better dancer than worrying about choreography. I'm going to say minimal partner work. It's zero partner work. I recommend zero partner work, but if you are in a cohort setting, if you are starting to work on choreo, then you can have some partner work because they are staying together. No more hugs, and I know for some teachers that's going to be hard, and for some students it's very hard. No handouts to the parents. They need to be getting that information online. There's lots of different apps and ways to spread your information. For your younger dancers, unfortunately, there's no more stickers, no more candy handouts at the end of class. We need to find other ways to encourage and build their confidence and give positive feedback. So as you can see, I'm going to really stress the slow class planning. If you are doing mixed classes, so if you're doing Zoom and in person, learning how to divide your attention and finding that the proper place to stand to give direction. So if you were demonstrating, make sure you're in a place where not only the camera can see you, but the students in class can see you, and trying to not forget one or the other group. We're going to talk about that variety level of isolation. You're going to have dancers that found classes to do or worked on their strength and conditioning, and then you're going to have dancers that honestly getting through their school day was as much as they could handle. Lots of people didn't work on jumps, so you may have to go back to some basic jumps at first to get them back in the groove. So assess, I apologize, it says athletes, assess your dancers. Many of them have grown. Many of them are going to have to relearn how to be in the proper position because they're not sure where their body is anymore. And again, so we're going to focus on technique, and it's always great to go back to basics. Ballet teacher say you are never too good to do what you learned in primary and pre-primary ballet. You can always improve the basics. So limiting your repetitiveness. So even though we're going to focus on the technique and our basics, we want to make sure we're not doing the same thing over and over again for half our class. So breaking your skills down in finding different ways to improve the skill. So work on conditioning and strength. Go back and work on techniques. We're going to go back to fundamentals. So as much as your dancers may hate you, you're going to talk about pliés in second when they're used to pliéing in fifth. And you're going to work on single pirouettes if they're used to doing triples and quads. But going back to basics and working on those fundamentals is highly important. Stressing less choreography, especially right now and into September when we're just getting back. Doing little combos can be fun, but it's also a chance for them to get hurt. Try and make class fun, especially right now at the beginning. They kind of need some joy and some laughter. So, dancers are athletes, and we need to be an athlete to be able to dance. I find, work on the artistic side of a dancer, but we need to start focusing more on the athletic side of the dancer. So when you're trying to figure out what to do, why don't you try something new? You can bring in an injury prevention program. They have shown up to have a 40% decrease in lower body injuries, but that actually increases to 75% in females. So since the majority of our dancers are females, this could be a huge game changer in regards to keeping your dancers healthy and strong. So you got to think outside the box for our conditioning and cross training. Progressive ballet technique is amazing. I use some of the exercises when I'm working and rehabbing dancers, but unfortunately it doesn't count as cross training. So you can bring in the experts to educate your dancers and yourself in regards to everything from injury prevention, management, nutrition, mental skills, how to move, bring in people to educate them on where they can go in the future. Try and switch it up. This is a time that you can kind of use to do all those things you don't normally have time to do. So what are fundamental movements? So we work on balancing skills, locomotor, so running, jumping, hopping, and galloping, ball skills, and you'd be amazed at how all of these actually come into a major role into how your dancers move. So a dancer that knows how to jump properly in a normal, let's say, gym setting is going to be able to jump better in the studio. If they know how to throw, you are going to see that they have better control in their upper body, as well as better control when using props. But another way to look at fundamental movements are, can they squat? Can they lunge? Do they know how to push and pull? Do they know how to twist? So there's your balancing. How do they walk? Do they know how to hip hinge? And do they know how to brace? So those come from Dr. Nico. He has presented at the IADAMS conference a couple of times, and he currently has a program coming out for injury prevention in dancers and he's just working on submitting his for publishing. So I don't quite have the stats, but he did say that he's not only saw a little bit of a decrease in injuries, but saw an increase in performance. So injury prevention in general, we progressively increase our intensity. We want to focus on technique. Like I said, do all those things you always want to do. We don't want to fall into repetition holes, so we don't want to be doing the same exercises over and over again. Switch it up. That helps reduce overuse, as well as teaches the dancers how to use their muscles in different ways. Avoid high-risk activities. So if you're especially coming back into more of an acro-based program, or have acro at your studio, we should not be doing our high-risk activities right off the bat, since they haven't been doing them for a while. So going back into building the skills is important. So the 11 Plus Dance, that is the program coming out from Dr. Nico. He had shown increase in performances compared to just doing your standard conditioning, dance conditioning class. But we are relating that full release of the outcomes. The U of C does have a neuromuscular program for injury prevention and warm-up, which can work really well for dancers. You can look at area-specific programs. So if you were finding that you have lots of dancers getting hamstring injuries, there are hamstring-specific programs that you can implement and give them to work on. So injury management. So what happens if a dancer gets hurt? The recommendation is that family members or staff is supposed to treat the injuries. This works great, except for the fact that we're not allowing parents into the studios. So unfortunately, it's probably going to fall onto you to do the management of skills. So make sure you're wearing PPE, so have your gloves on and a mask. Adjust your EAP, so ask your studio how they've changed their emergency action plan in regards to now dealing with COVID. If you do have an unresponsive dancer, you can choose to do compression-only CPR. If you do have a pocket mask, you can use it if you feel comfortable to do so, and that's coming from the Red Cross themselves. Now, what injuries should we call an ambulance for? So if you have a dancer who has pain in their spine, they have uncontrollable bleedings, whether or not they have cardiac or respiratory arrest, any open fractures, and hip and ankle dislocations. So in those instances, when you would call an ambulance. Otherwise, you should be able to manage the injuries yourself. Now, injury awareness. So this is both for you as a teacher and for your dancers. So we have been down for a long time, and that's going to increase our injury rate. Typically, we do too much, too soon, or too fast. Like I said, you were the jockey, and you need to keep them at bay. They should be sore after their first few classes back. That's normal. But if that pain persists for longer than a few days, they should seek treatment. We're all a little apprehensive. We all have a little bit of anxiety going on right now, so that's going to create tension in our body. Therefore, that does increase the chance of injury, because they're going to try and push themselves into where they used to be versus what they can do now. So dealing with that tension and teaching them to relax, and that it's okay if they went a little bit backwards, that it's okay to do so. And prime example of that was I had a dancer who just last week had been doing online classes with a choreographer, enjoying them, loving them. They got to do in class in studio last week, and she thought, oh, this should be no problem, and ended up straining her low back, because the difference between the online let's move class to the let's do a combo choreo class was a big difference. So we want to be understanding with our dancers. Right now, coming back to the studio is, as I said, familiar. It's not normal. Having to line up to go in, get your temperature taken, not being allowed to stand close to their colleagues. It's familiar to be there, but it's not their normal. So you're going to have varying degrees of comfort in regards to even each teacher to each dancer and studio to studio. And we need to be understanding and accepting of whatever our dancers feel. The kids are stressed. They get it from seeing what's been going on. Things are a little bit better now that we're into the summer, but through the end of school year, the kids were extremely stressed about having to be online and still having to do their schoolwork. So understand some of that stress may have carried over. As we near August, they're going to start to get stressed about whether or not they're going back to school. Are we going to be in class? Are we going to be online? Are we doing a bit of both? Are we going to get to be in class for dance as well? Parents are stressed, and that's rubbing off on the kids. So understand that you're stressed, they're stressed, and we all have different feelings about what's going on. Be very clear as to the protocols for your studio, how they're going to arrive to class, what needs to happen when they're at class, and how they behave in class. If you need to change that at all time, don't make it as they're walking into the studio, this is our change. Give them time to absorb the change. That way they can adjust in their mind what it's going to be like. And depending upon how the change makes, they can make the decision whether or not they will attend. So I know you dance teachers have amazing patience, but now it needs to be used even more than ever. Okay? Kids aren't used to the new rules, and especially we get to I'm finding the young ones and the older ones are the ones that are having a harder time. So the young ones don't quite get it. They want to know why they can't hug their best friend. And the older ones are used to having freedom and are making their own decisions and are having a harder time understanding why they can't do what they want to do. So you may have to explain more than once as to why they're not allowed to touch each other or stand next to each other in their boxes. So we want to guide them. Coming back to the studio is going to give them structure that they've been missing. They've had a sense of loss. Their school year was disrupted. Their dance season was disrupted. Their social life has been disrupted. They only can get to see their friends through their phone or their computer. Maybe they get to see them from 2 meters away, but they're going to have a sense of loss, and some may be grieving about what has happened. As I said earlier, the unknown. We don't know what the season's going to look like. We don't know what school year is going to look like. So they have fear. So help them set goals. Reaffirm how they feel. If you're still doing at-home training, or if you have students that aren't coming into drop-ins, maybe touch base with them, see how they're doing. You might be able to just give them a couple exercises they can do to help them continue to progress. Dancers may have fallen behind. They may not have been able to maintain their strength, their conditioning, their flexibility. As we all know, flexibility is one of the first things to go. So what they may have been able to do, they can't now, and they'll be frustrated. So try to be supportive and find victories at each day that you're in the studio. You might have to help them change their definition of what success is or what their normal is. And it's quite okay to redefine it. So you may have a dancer who's used to being able to do leg holds on both sides, and they've lost one side. That's okay. Don't stress them out about it. Don't you stress about it, and apply that extra pressure. Help them understand it's okay, and then make that goal of working to get back to do that. So we want our dancers, and strive to do this regularly, but even more so now, only compare them to themselves. They are allowed to have a bad day, and then we want to build back off of that bad day and improve. But they need to compare themselves to themselves now, not themselves in March or February, and they need not to compare themselves to the person next to them. Their colleagues may not have grown as much. They might have had better access to be able to do things. And so everybody changed during the time. So they need to compare only to themselves and try and better than themselves. So the Canada approach. It came from the Canadian Centre for Mental Health, but I kind of like how we can use part of it even as part of a screen as a dance teacher and a health professional when they come in to your setting. So the Canada approach: check in, acceptance, navigate, adapt, discuss, and act. And we're going to break down each one. So the checking in. So how are they feeling? They want to look for the signals. So they're either going to be in the green, yellow, or red zone. And they have to tell them how they feel, what it sounds like to them, and what things look like to them. And that can help them decide where they're at. I kind of like the idea of adding this to your screen or checking in with them at the beginning of class. And you can just say, are you green, yellow, or red? And not only would it help them, but you in guiding them through that class. Some school teachers have started to, before COVID, what they would do is they would, as the student would come in for the day, they got to say if they were like thumbs up, thumbs sideways, or thumbs down, or they would go put stickers on with their name as to what color they were, and it helped the teacher and the student guide their day, because we all know that student who comes in who's probably in that yellow, in the red zone, and you might not quite know about it, and you ask them to do something and they might lash out at you or get mad at one of their fellow students as they're in line to do across the floor, where if we had checked in beforehand, we might have been able to find a way to get around that. So acceptance, and this is good, like I said, at any time, is ask them what they can control. And going back to that, they really can only control themselves. They can control their effort, and they can control what they're giving back to the class and to themselves. A grounding technique that is very useful is if they are either too high or too low. And that's one misconception, is that, let's say kids are in the red zone or they're in the yellow zone, they could be sliding up or sliding down. So to kind of get back to that green, you can do a grounding exercise and ask them to look at 5 things they see, 4 they can touch, 3 they can hear, 2 they can smell, and 1 they can taste. And they want to be things that are in their area around them. So what's in the studio, what's in the entranceway into the studio, that they can look at it. It helps ground them, and it helps bring them back into that more neutral area. So let's say they are in the red zone or the yellow zone. How can they change? How can we adapt our day into our training? What can we do to make it a better day and a better training opportunity? Do they have someone to talk to? So let's say we're having more than just that single bad day, and they talk to you as a teacher. Do they have a family member or a friend they can talk to? And then there's the mental health resources. That if they're having what we're seeing is more than the one bad day, that we can refer them to. And if you do want the links to this, let me know and I'll send them to you at the end. So now that we decided we need to adapt, what can we do? So this is where setting out our goals and having actionable points to do towards those goals. So this works really well for those students that have gone backwards or have fallen behind compared to their other colleagues and dance friends. So give them, set the goals and work towards them. Remembering goals need to be specific, measurable, attainable, realistic, and a timeline. I'm not really big on the timeline part of those right now, because everything is kind of up in the air. None of us have a timeline, but making sure they're making realistic ones. So again, so if they're having more than just one bad day, so this is a little bit more when we get back into the season, but depending upon how your summer programs are working, you may see your dancers regularly. We want to check for changes in behavior or communication. If they're more irritable, if they're starting to be social withdrawn, so if you have the social butterfly that's now sitting over in the corner not wanting to participate, or any out of character behavior. If this lasts for more than 7 to 14 days, we want to refer back to that mental health resource and find a mental health practitioner in your area that can help them. So you're gonna find you're gonna have dancers that are gonna stick with us. That are gonna come back this season. They are more dedicated, and you may have dancers that find out that they don't want to dance as much as they did before. But they do have some love for dance, and that's why we are here. And you as a teacher are here because you want to make that return to dance as enjoyable and successful as possible for your dancers. So, all right, I apologize that the sound didn't work. What it was pretty much she was explaining to us all the things she's gotten from dance. And I just wanted to have that reminder to all of us that dance is more than just being on the stage. That our dancers learn life lessons, and this is kind of a big time that we can help them focus on that part. So this is a list of the references that I kind of used, partial list of references that I used for this program. Today, again, I can send you the list of links so you can do more information looking up yourself. If you guys have any questions, throw it in the chat. I'd love to hear what you guys have going on in your heads. And then I wanted to let you know that I will be a lifeline for you. So if we all remember Who Wants to Be a Millionaire, you could call a friend. I can be that friend. I can help you figure out how your studio specifically can match your provincial guidelines and make sure that you and your students are safe when coming back. So you can get a hold of me at phone number 780-699-8084, or our email is info@eliteinjury.com, and I will be happy to. So face shields versus masks. It's kind of a one or the other based on the area that we're in. You're going to see certain health professions have to wear both, and depending about what store you're at, you might see both either. But it's kind of a one or the other. You don't necessarily need to be doing both. Now, in saying that, if you want to take the extra step of wearing both, go ahead. But they're finding that they're both kind of about equal in decreasing transmission. Of course, the best possible case is if you're both in masks, but based on the fact that dancers will be being fairly active, we are discouraging that. But masks is fine versus shields, or shields is fine versus masks. Depending what you want to do. One of the other options as a dance teacher you can do is have your mask on and then have the wireless mic on, so something similar to kind of what I have on my head, that's going through the speakers, so that you're not having to try and yell through the mask. If any of you are wearing masks out in public, you probably know that when you're in a store asking for something, there is that little bit harder time of understanding and communicating, so you might want to add a wireless mic to your teaching paraphernalia. Any other questions? Miss Jess. Yeah. It kind of goes back to that, the slides with the pictures of how to do it. So when we get to choreography, you're going to want to kind of keep what we're calling the cohort. So here in Alberta, our cohorts are 50. at the moment for sport and dance. So you can have that group of 50 dancers, and those dancers can be together. And it should include you, but as long as you say yourself not touching the dancers, then you can be outside of that cohort. Because I know that you guys have to go to different groups and different classes. When you get there, they have to be cohorted to be able to do choreography. No, cohorts don't need the social distance. Cohorts are allowed to touch, which is great, but you can only be part of one cohort. So if you have, for one sport cohort, I don't want to say sport cohort, dance cohort, you can only be in the one. So that goes back to the, sorry, I'm going to pull up that other slide, the slide that shows it. So when we go back to this one, this kind of shows the cohort. So let's say group A is 20 kids and group B is 20 kids. So you could keep them as a separate cohort, but if you needed to, you could bring them together to create our cohort AB. And because they're only together, you can make your different groups, right? So you could, let's say this is your line, and then we can have a large group, and then we can have 3 small groups. So this works as long as we're in 50 dancers. What we have to be careful of doing is, let's say group C is a group of 40 dancers, and so we can't really bring them into another group. We can't take two students out of C and create a group with students out of AB and bring them together, because that's crossing cohorts. Does that make more sense? Okay, perfect. Thank you, Alyssa, for joining. Yeah, cohort, like, I have to say, working on the grids and this cohorting, it hurt my head. And yes, for you guys, check your cohort size and to see where you're at. And it's saying in Alberta by the fall we might be able to jump beyond 50, but I'm very much about let's keep it smaller, because it's better to keep at a previous recommendation versus jumping to the new one, and then if you have to go backwards, then you're in trouble. So, and not knowing how competitions are going to run if we get to that point, it's dicey, right? So this is kind of the way I kind of look at it, is you can mix A and B, but you can't involve C to create group D. So you are going to spend, your 2 hardest things right now are going to be A, doing your class sizes and schedules, and then figuring out how you're going to make choreography work. Okay, so stage D. And that's the other thing, is every province, the stages are different. So we are currently in stage 2 and in Alberta, and dance was supposed to be in 3, it got bumped to 2. So we're still in stage 2, and I don't even know when we're talking about stage 3 yet. So you have to make sure that you're doing your stage specific, and then if you do compete out of province or have people coming in from out of province, you need to look at that as well. So I'll go to that slide again. So yeah, so here is again my contact info. So if you want the links, send me an email. If you want help, send me an email. I would love to help you guys sort through this, because I know it can be confusing, and as a studio owner possibly, and a teacher, on how to do it. So if you guys have no other questions, I want to thank you for joining. It was very fun coming up with this one. So thank you for joining. And again, if you have any questions, send me a message, and I will hopefully hear from you guys later. Have a good night.